Let's talk about how to add $50,000 to your monthly collections, and we're doing that by investing in your practice. The way to stay relevant in this day and age in your practice is by investing in a medical device like a red light therapy device or a Shockwave device. We're going to talk about both of those today and how each of those can impact not only your practice and your success, but all the patients in your area. I'm Zach Herman, owner of Automated Practice, where we help health and wellness practices grow through the use of systems, automations, and paid advertisements to bring in new patients and turn them into lifelong patients. Now, in order to almost stay afloat these days, practices across the nation are investing in devices. The reason that practices across the world are doing this is because whatever your services may be currently, you may be limiting the amount of patients in your area that you can treat. So you start opening up your patient base, possibly even doubling what you could do prior to investing. So we're going to talk about red light therapy and Shockwave. And so specifically with red light therapy, we really like the red light beds. In our businesses, we actually help sell those. And then for Shockwave, we're going to specifically talk about one of our favorite devices. That's Softwave TRT, and commonly known as Softwave therapy. So this is the leading device in the space. It has a certain patented FDA approved technology that is unfocused and treats a larger area. The reason we love this one is because it just treats the patient much more efficiently with the unfocused shock waves. That means less shocks per patient or per area, and it's not with these focused shock waves with the other competitors, it's could be painful. This is what NFL teams, NBA teams, and so forth are all using, and there's a lot of these professional teams that own one. So we're going to talk about both of those devices today and how it can help your practice. Let's talk about Shockwave therapy, and let's talk about specifically the Softwave TRT device. Now this, a lot of what I talk about could be utilized for any Shockwave device. In fact, in our agency, we help many practice owners with any other kind of Shockwave device. There's plenty of amazing ones out there. We're just very knowledgeable in the Softwave TRT space. So let's say, for example, you're a chiropractor and you've just implemented Softwave into your practice. The biggest reason why this is going to possibly double, even triple the amount of collections that you're going to get is because you're going to be able to see a much wider population, and you're not going to have to turn down a lot of the cases that you might have had to before. This thing does obviously, pain management and so forth, but it goes way beyond that. We're talking, it helps with burns, it helps with healing wounds. This is the same technology that was utilized, or that is utilized, to break up kidney stones in the hospitals, obviously at a much lesser strength, but this technology is insane. So you're going to be able to treat joints like never before, knee pain, frozen shoulder, plantar fasciitis. The list just goes on and on. This is really going to help your patients with these pains that you've never been able to treat like this before. This is actually going to stimulate the body's natural healing process, and it's going to provide pain relief actually right there on the first visit, increased mobility. My wife and I have gotten treatments. We've gone through the whole 8 sessions, and you feel, let's say it's a shoulder injury. You might start here, maybe going up to 90, but then, after you're stiff there, once you get the treatment, you can literally put your, shoulder almost all the way up. So these patients see this insane results right there on the first visit. So then talking about red light and a red light therapy bed in this example, you're able to treat these patients full body in 12 minutes. So this is absolutely insane. With red light, you also can treat pain. It reduces inflammation. So we all know how well that's going to help out with pain. It helps. The first thing they're going to do when they get out of this bed, they're going to feel rejuvenated, energized. They're going to have reduced pain. They're going to sleep better. But the moneymaker is red light therapy can actually help the patient lose inches on the first visit even. So they're getting that same wow factor on that first visit. So you can bring a lot of these people in for the body contouring or the inch loss or the weight loss. Then they can also see the benefits, the much deeper benefits of red light therapy, including nerve pain and neuropathy, muscle recovery, and all the other symptoms. The aesthetic benefits, like I said, the weight loss, the skin tightening, it makes people look and feel younger. This device is crazy. I mean, it even helps with hair regrowth. So the benefits, it's almost, if I were to read them all, you would think this is just snake oil, but I promise you, look up the benefits, deep dive into red light therapy and all the scientific studies behind it. It's absolutely insane. So with Shockwave and red light, I mean, you're able to bring these patients in, they're able to have that wow on their first visit. And you can imagine how that does with conversions. So on both devices, they're a solid investment. And that's for a good reason. But they average out to, let's say, about $1,500 a month, with financing. And that is absolutely nothing compared to the return on investment you will for sure make on these devices. With Softwave, you're looking at about $1,200 to $1,500 for that 8 treatment care plan. And then with the red light full body bed treatment, you're looking at between $1,500 to even $2,500 for about 10 visits. So let's just find a safe sort of lower average and say $1,500 is the average care plan between the two. And then if you're talking about just return on investment, I mean, selling one package per month gets you at the break even. But we're talking about doing 5 to 10 a week. So between your current patients signing on for these new offerings of yours, or running paid ads, or doing a referral program to where your current patients can refer in new patients, I mean, you're going to absolutely make a killing on either of these devices. So just touching on that, when you first bring in the device, do something like a patient appreciation day and let all your patients come in, celebrate the new investment, and let them have a free treatment. They're going to absolutely fall in love with your new offering, and they're likely going to sign up for care. They're going to tell their friends about it. So do this patient appreciation day. Even let your old patients know about this, the ones you miss and you want them to come back. Let them know you have something brand new, and bring them in. So let's talk real quick about how red light therapy works. Red light therapy actually stimulates your body's mitochondria to boost energy production. This helps your body naturally break down fat cells without the need for any surgery. So this does a really good job at what they quote unquote say melting fat cells. And then you actually get on a vibration plate, if you're familiar, and this sort of creates a drainage effect. And that's why these patients see this immediate inch loss, which is really cool. And then so for things like neuropathy, it actually stimulates blood flow to the nerves, which leads to better oxygen and nutrient delivery to the nerves. So, neuropathy is very involved with nerve pain, tingling, and all that. So this is a really good benefit for those patients as well. And then with the, muscle recovery, it increases blood flow, like I said. So there's just so many benefits that this amazing device covers. So like I said, they come in, a lot of them will come in from the paid ads for the inch loss and the aesthetics and the skin tightening, and then end up seeing the vast array of benefits. Even without knowing, they just feel so much better. They feel energized, and the session is just, we actually have one here in our office, and it just feels like you're on the beach a bit. It has that nice warmth. It has we have a fan going, so you just kind of feel like that breeze, and it's just a relaxing 12 minutes. You put in some headphones or you play music. It's just a lot of patients just want to come back regardless of all the benefits that they're feeling. So the way the treatments work is, like I said, they're a 12-minute full body treatment. So the patient comes in, and if you're doing like a fat loss, weight loss thing, you would likely take some before photos, you would do some measurements, take the weight, ask about their goals, And then they hop in the device, and then they, you can go in with underwear, and you have this in a private room. And so they go in, they can actually, there's a LCD screen, you configure the wavelengths for that individual and their goals, and then the patient can click start, and there's about a 15-second countdown. They go in, they close the lid, and they enjoy their treatment. Then that treatment ends, they hop out, and then they hop on the vibration plate if you have one. A lot of these devices, like the one we have in our office, the Trifecta Pro 450, will ship with a vibration plate and a lot of the tools that you need. And here's one of the coolest things about it is after you've shown them how to use it on that first visit, every other visit, they can literally just go into the room and do their thing. And so you don't need extra staff for this device. Like, that is absolutely insane that you can invest in this device, have a whole new offering, and not need to hire anybody. So then let's talk about how Softwave TRT works, or a lot of the Shockwave therapies. So it uses therapeutic energy waves to activate the body's natural healing process. So when you have these injuries, new or old, that aren't getting any better, this Shockwave device will come in and activate that area to have your body heal that. So you're not injecting meds or steroids. You're doing this the right way. And, you're not taking a bunch of medication or getting surgery. This is what the pain medication doctors don't want you to know about. And that's why it's hard to get that covered by insurance, because it doesn't come with medication. But that's a whole nother topic. So it's, like I said, treating a lot of the pain management. It is helping with increased mobility, and then other things like wound management. We talked about plantar fasciitis, and you're just going to be able to treat so many joints that you weren't able to before. So the way the treatment's going to work with Shockwave or Softwave is you're going to come in, the patient's going to come in, they're going to tell you about the area in which they're wanting to get treatment. Let's say it's the knee. The nice thing about Softwave is you actually start by utilizing it as a diagnostic tool. You actually use a ultrasound type gel, and you put it on the applicator, you start it up, they hear some shock waves. It's like a pop, pop, pop noise. And honestly, it's as pain, like the most it could ever be as far as pain is like a rubber band snap to your skin. That would be what I would say is the most intense pain that could ever deliver. But back to the diagnostic is the way that it would work is if you have some pain in the shoulder or the knee, the device is going to determine sort of where that pain is coming from. So they're going to use that applicator in the area, and the patient isn't going to feel anything if the device can't help in that area. So that's really cool. It shows them if they're a candidate or not. So once they start feeling, the patient's going to give you feedback on, okay, that's it right there. And then the device is starting to go to work. So if they're feeling that, then you want to kind of focus on that area. And that's going to, again, activate that body's natural healing process in that area. So you get the diagnostic aspect, and then you get treatment immediately. And this, about 500 shockwaves or so, is only going to take a few minutes, and then the patient is done. There's rarely ever pain after. It's only like a little discomfort during, if any. And then they're immediately going to talk about how much better they feel on that first visit. They're going to show you the increased mobility. So it's just fantastic. So as soon as they get that's just a great time to get them on for that extended plan. One thing you should note to them is a lot of times after a couple of days that pain and decreased mobility will end up returning. So that needs to be clear. If you're not converting on day one, you need to be very clear about that and have them come back as soon as they can, regardless of, if they're on a plan, you need to do a day two. You really want to stress that way they don't think this is a failed procedure, because it comes back. And that's why you typically do 2 times a week for 2 weeks, and then go to 1 time per week. And then oftentimes they do a maintenance like once a month. So just further diving into how to implement these into your practice and how to get the most out of them. Again, we want to do that patient appreciation day. depending on the device. I know Softwave specifically will, once they deliver it, a trainer will actually go to your practice and be with you on that first day. And that's a great day to bring in all your favorite patients and just fill that calendar up with 15 to 30 minute slots. And you just have a waiting room full and you're just treating. You might have somebody there taking video, but they're showing you how to use it. And these patients are getting these amazing results and you're seeing so many different cases. And this day oftentimes turns into recouping a large percentage of that investment that you've already done. I've seen, I've actually been on to a few of these trainings, and we're talking 20, 30,000 on that day one, because everyone's just so excited about it. They're getting better. And then imagine who they're calling and referring. So have that patient appreciation day. Not to mention, after you've had this for a while, it doesn't hurt to, implement this quarterly. You also want to re-engage past patients. So I know if you've been in business for even a few years, there's probably a handful, if not tens of hundreds of patients that have been through your practice that you loved and had a great relationship with. So do a patient reactivation campaign, or for simpler words, just reach out to all of them, shoot them a text or an email, or have someone on your team call them, let them know about this amazing device that you just invested in and how it can help them. Almost everybody has some sort of pain or wants to lose weight. So let them know and bring them in. Those two things alone will keep you busy for months alone without doing any paid advertising. Speaking of which, you want to start running some paid advertisements. I know there's a lot of practices out there that, just rely on referrals. And I believe referrals are the best. But one thing I'm very keen on is don't let your patients dictate your practice's success. Don't put it in their hands. So run some paid ads for both of these services. It's such an easy barrier of entry to just simply run an ad for, say 40 something, 50, 60 something dollars. And don't try to make so much money on this first visit. I think I have another video about barrier of entry and how ads work. And, if you want these people to spend a ton of money on the first visit, they're going to go try someone else. Facebook's going to quote unquote penalize you because no one's clicking on it. So there's a whole thing to it. There's a lot of misconception about pricing, and, hey, lawyers do the first call for free, and it's going to be thousands after. So get that low barrier of entry, run those ads, get these new patients in. A lot of these people haven't came to see you because maybe they don't believe in your modalities, or they believe that you couldn't help, what have you, or they just couldn't treat them. And so there's this whole population of people that need to come see you now. So let them know you exist. Let them know you've invested in this amazing product, and bring them in. And then you should also post organic content. So show patients before and after and getting treated and their testimonials and how much they love it, and show your area that you're the expert in this modality, and continually post that when they see your ads. That helps. And then, of course, I love referrals. So implement a referral program in your practice. This goes for general practice growth, but have a QR code at the front, or if we have a system, we have a referral system that's all automated that we offer, but you could do pen and paper style. You don't need to go crazy with this. Just after they get that insane benefit from that first visit, ask them to write down 3 people that might really benefit from this as well. And you can reward them if you'd like. I know there's regulations in certain areas, but generate referrals, because you're just leaving money on the table otherwise. So as far as like what you need staff-wise, Softwave, Shockwave, you need a trained staff member to do that. And I believe they provide trainings. And then for red light, you actually don't need any license or what have you. Anyone can utilize it. In fact, that's why these patients can go in there and utilize this device by themselves. And that's why you don't need to hire anyone for this. So let's break down how you can actually, like I said, make $50,000 extra per month off of these devices. So going back to our average care plan of $1,500, again, with a red light, that might be upwards of $2,000, even $2,500, but I'm going to use a lower number to just help model this example. At $1,500, to get to 50,000, we're talking about 33 plans sold per month. So that averages to about 7 or 8 per week, which then averages to about 1 to 2 per day. So if we're implementing everything I talked about earlier, you have every day filled with a handful of patients that are excited about this treatment, and all you need to do is close 1 or 2 of them. So that alone, just at 1,500, gets you to that 50K pretty easily. And if you're implementing all the strategies in this video, it's not going to be hard. And even if these goals seem crazy, 1 to 2 a day seems crazy, even if you do 3 per week, you're looking at almost 20 grand. So yes, this is a how to make $50,000, but also this is just how to make an insane ROI off something that you may think is so insanely expensive, but really when it's only $1,500 a month and one package price is going to help you break even, this is a money machine. And that's why every practice in your area is investing in these devices. So right now you're at the point in which when you do invest in these, this is new to most patients in your area. But if we're fast forwarding a couple of years from now, this might just be, these devices that separate practices might just become the new normal. And so you're not going to want to get left behind. So I hope that was helpful. If you've ever been considering these devices, this hopefully pushed you over the edge. If you need more information about either one of these devices, we can actually help you attain these devices. We can 100% get you the best price and include some of our fantastic agency offerings with this. Otherwise, if you're in talks with somebody and you're on the fence, just go for it, because this is going to be massive for your practice. So again, I hope that was helpful. I would invite you, if you want to see more of this, to like or subscribe. And if you have one of these devices and you are in need of some growth with it, we do that in our agency automated practice. So reach out to us. Thank you, and I'll see you on the next video.